3, 2, 1.
Good morning, everyone. Welcome to the budget decision session for myself, the Executive Member for Health and Adult Social Care, Councillor Carol Runciman, on Wednesday, the 13th of January 2021. I'd like to start by saying I have no particular declarations of interest that relate to this meeting other than those declared in my declarations. The minutes of the last meeting I'm happy to accept as correct and will sign them at another time if appropriate. Public participation. We have 2 people registered to speak and the first is Councillor Anna Perrott.
Thank you, Chair. Thank you for giving me the opportunity to speak at this meeting because I realise that the issues around adequate funding for health and adult social care are very long-standing and deeply challenging, but I'd like to raise a few points of concern and ask some questions if I may. So firstly, I just wanted to ask why now for some of these cuts? Could any of the savings have been realised in past years? As the statements made in the papers on page 14, paragraph 54, that where savings are proposed, these are focused on improving services. My concern is that cuts to a directorate which has found itself under increasing pressure to deliver more with less due to austerity and demographic change will have a deeply felt impact. So are these cuts designed to improve services or are they a consequence of budget requirements? Because it does not naturally follow that savings necessarily equate to improvements. Year on year, we're asking health and care staff to up their productivity, to work differently, to do more with less, and it's just not sustainable. The Health Foundation have argued that additional funding is needed to stabilise the system, let alone make improvements. So it would be good if you could explain why sort of the cuts would lead to improvements in your opinion. Can the member also talk me through which proposals are the highest risk both to residents and in terms of actually realising the savings? Because in previous years we've seen multi-million pound overspends in adult social care, and if the same continues next year, which savings will not be met? I suppose to put it another way, are there any high priorities for you amongst these savings? Which ones do you really want to realise? The next concern I wanted to raise is that a few of the just suggested savings, they rely on the care market to negotiate agreed cost of care placements with us. And coronavirus has really laid bare some of the fragilities at the heart of the care sector, with the operating model that relies on high occupancy rates being broken at the moment. So many of the savings we suggest can be made within the budget. They rely on us exploring options to commission places at lower level fees than are currently paid, to provide guaranteed incomes for the sector as it recovers from the impact of the pandemic. So what guarantees can the exec member give that if we negotiate a lower fee, this will not translate to a lower standard of care or have any negative impact on employment terms and conditions for care workers who we know already do see quite low pay and some insecure contracts as well? And could the exec member please reassure me that the independent care sector actually have an appetite to take on such arrangements, because we'll no longer have any local authority run care homes after the transfer of Haxby Hall. So do we run the risk of losing any goodwill from private providers as we use this opportunity to seek financial saving in the short term when it comes to renegotiating agreed cost of care contracts in future years, because we won't have the capacity to take this on in-house and we'll have to rely on the market not to take advantage of that fact? Can I also ask for some clarification on what exactly is the increase in the independent sector that's included within the savings proposals? What will the independent sector be doing more of and us less of? And finally, how do we square the cut of £33,000 to restructure the public health team with the results of the budget consultation, which saw 73% of respondents listing it as the highest priority for local people to prioritise our public health response to the pandemic, including support for mental health? Thank you for allowing me to ask many questions this morning, Carol.
Thank you very much, Councillor Perrott. Whether we can get through all the answers, I don't know, but we'll certainly try. And we might want you to email your questions so that we can have a look at them in more detail later. Can I now call on Councillor Ashley Mason?
Good morning, Councillor Runciman and officers. Firstly, thank you, and I will try and be as brief as I can, and just wanted to note some of the investments and some of the highlights in the proposal. Despite the financial pressures facing the council and the government's failure to reform adult social care funding arrangements for many years, I'm happy to see the significant investment in social care outlined in these proposals. More specifically, I'd like to note the proposed investment into mental health and carer support as part of our COVID-19 recovery fund. I've previously spoken about my own experience and understanding of everyday emotional and financial struggles facing carers, particularly unpaid carers, and action to support the hundreds of unpaid and paid carers who have given so much during this pandemic was supported unanimously at last full council. Therefore, I'm happy to see the proposals already in place to invest in supporting carers through projects which make a real difference. We've also seen the toll lockdown has taken on mental health. Actually, this was briefly touched on by our last speaker. The scale and the seriousness of the rise in depression and other serious mental health issues over the last year is extremely worrying. With many experiencing bereavement, anxiety and isolation, it's clear that there'll be long-term mental health impacts for so many, long after the pandemic is finished. I'm happy to see this recognised in the budget proposal, and I'm sure the investment will be able to provide direct help to people struggling here in the city. Whilst investment and overall improvement of mental health provision and support locally is of course important, it's crucial for the government nationally to appreciate the impact that this crisis has had on all our well-being and mental health. I hope we will soon enough be able to see them act so that no one slips through any of the nets in terms of the mental health problems that this crisis will have brought on. Although I'm not very optimistic that that will happen. So really pleased that the administration's been able to step in and pick up some of these issues quite quickly and hopefully help people in the city recover from the pandemic in all respects, despite all the challenges that the council is facing. Thank you.
Thank you very much, Councillor Mason. Now we move on to agenda item 4, which is the financial strategy. And I'm going to ask our Chief Financial Officer, Debbie, to introduce this item, and then I'll go to the Corporate Director of People to take it up from there. Thank you, Debbie.
Thank you, Chair. So just to give some of the overarching budget context, these budget proposals have been prepared in the context of an unprecedented financial challenge and uncertainty due to the pandemic that's seen increased demand for services and support, particularly in this portfolio, alongside reductions in income across all council services. The spending review was announced in November 2020, but that was only for 1 year, and therefore that didn't provide us with any further certainty to help with our financial planning. And really there was no additional funding for local government beyond those one-off COVID related funding items. The key assumption in the report is a proposed council tax increase of 1.99% plus a 3% adult social care precept, and that funding will be ring-fenced to adult social care services. We've identified pressures of just over 12 million, so that leaves us with a budget gap of just under 8 million to be found from budget savings. The underlying requirement from a financial point of view has been to maintain a stable financial position in the midst of the current uncertainty, alongside dealing with some of the challenges facing adult social care in particular. And as everybody on this call is aware, that's a national issue that will require government to identify a sustainable long-term funding solution. The proposals also include the creation of a COVID contingency to deal with further pressures that will be expected in the early part of the new financial year, but also to support, accelerate recovery and support our communities. And the proposals do include investment in both adults and children's social care. Just in relation to something that one of the public speakers said around the 33,000 public health saving, I would just also draw your attention to the net nil position on public health, because for the total of 183k of public health savings that are included, there is 183k of growth as well. So I'm sure Sharon may wish to comment on that later in terms of the overall balance of budget in public health services. So then it would just be to point out that the annexes to the report outline the detailed proposals for this portfolio, for growth, savings and capital, and they also include a summary of the consultation responses that have been received to date. The consultation exercise is ongoing and is open for residents to comment up to the 31st of January. And so I'll leave it there and hand on to Amanda.
Thank you. Amanda, would you like to take it up from the adult social care perspective?
Morning, everyone. Thanks, Councillor Runciman, and thanks, Debbie. As one of the public speakers said, this is a challenging time to be looking at budget savings, not least because of the long-term challenges in relation to adult social care funding, but also because COVID has absolutely added to those challenges and increased demand in this area significantly. One of the questions was, are all of these savings necessary? And do all of these savings need to be met this year? Sadly, yes, is the answer to both of those. Debbie's outlined the financial situation that we find ourselves in. And we are in a position where we have to make the savings this year, recognising that previous years' savings haven't been made. We're also, though, in a slightly different position in that we can now, as part of a people directorate, look to maximise some of the opportunities that we have around how can we work differently together to offer services to people who may be in need of long-term provision that might be more seamless in terms of transition from children's services into adult services, and might also be a different way of delivering services, building on the good work we've already done around building resilience in communities, in families, and supporting individuals to not have a dependency on service, but to build their own reserves and their own resilience. The other area that a number of the savings relate to is around market management and looking at how we procure services and how we buy services differently. And thinking about how can we do that on a different and potentially bigger footprint? How can we work with partners differently so that we get more economies of scale, and hope that we can achieve that through working differently with some of our partner agencies and some other of our neighbours potentially. So it is a challenging picture. There are a number of savings that they are going to be difficult to achieve, particularly in the context, but it's a situation we find ourselves in because of some of the funding pressures that we have more broadly.
Thank you very much. And can I have the Director of Public Health, Sharon Stoltz, to make a comment about the public health part of the budget?
Yes, Chair. So the proposals in the budget for public health are really around how we can realise savings by restructuring some of the service areas in public health to be able to reinvest that funding into other priorities. So the government has maintained the public health grant allocation for next year, but has not increased it. We have a range of public health priorities that have emerged, particularly as a result of the long-term impacts of the pandemic. And so, as Debbie has already indicated, there are £183,000 of savings to be released through service redesign, but then that money has been released to be reinvested, and there will be a future report brought to you, Chair, to a future decision session that will set out how we intend to reinvest that 183,000.
Thank you very much. I'd like to go to Assistant Director Pippa Corner next about quality. One of the concerns that has been raised by Councillor Perrott is quality of the people that are providing services for us in a commissioned way. I wonder if you can talk about how we ensure quality.
Yes, thank you, Chair. Certainly, we're in a positive position in York. Our care market has had high standards for a long time. And, you know, as judged by the Care Quality Commission, we have good ratings and no inadequate ratings in our services. We regularly liaise with the Care Quality Commission and with providers. And in the Adult Social Care Commissioning and Contracts team, we have very active relationships with all providers In the past, that meant going and visiting providers such as care homes and home care services and seeing how they are at the front line. We're doing that remotely now, but the relationships are strong and we're able to obtain good intelligence and information around what's happening. That's not to be complacent. There will always be occasions where a family or an individual has a cause for complaint, which is investigated. And if we think to more recent times through the pandemic, we've worked extremely closely both with public health and with colleagues in the clinical commissioning group around their infection prevention and control team, and share that work together to make sure that we're supporting all providers to manage the infection that we've all experienced. It's not been easy, but it's a powerful focus of what we do. In terms of the budget context, we're not looking to make savings which are about reducing quality or cutting standards, but about working differently and trying to work in partnership with providers to give them more stability and expectations around demand and to plan together. I hope that helps.
Thank you. And I'd like to go to Assistant Director Michael Melvin to talk about the use of technology. One of the areas we're investing in is the use of technology, and that brings saving in itself. And I wondered if you could talk about that, Michael.
Thank you. Yes, over the past couple of years, we've developed an approach to technology which is becoming much more embedded and integrated as business as usual. So that when we're now having conversations with people in the care and support system, one of the first things which we do is talk about the different kinds of things which will help people lead the best kind of life rather than talk about services. And some of these are things which are different types of technology, things which we can use to both adapt people's environment, so that the environment, we don't need to send as many people in to ensure their kind of safety and care needs, but also things which enable people to get out in the community, meet people, connect with people, and overcome issues around loneliness, isolation, those kinds of things. So it's a mixture really of things which are quite often sort of phone app-based type of technology, which creates that connectedness and enables people to feel safe, but also around technology in people's homes as well, which enables people to be more independent from relying on calls from services. And that goes across all age groups as well, particularly strong in the work around preparation for adulthood, but also people with really complex needs who are living in independent living schemes and those kind of areas. We've run a number of pilots over the last year to try and work out some of the best kits that we've currently got. And we've got some really, really good support from our colleagues in the ICT department. We've got a dedicated project team to help us work out the best way to deploy that as we work with people. And as I said, it's now embedded in the methodology which we use in terms of reviewing people's support. So I'm really confident that over the next year and the year after that, we'll see technology play an increasing part in people with care and support needs lives. And it will create, help them lead better lives, but also be more efficient in terms of how we use our resources.
And Michael, do you feel that the investment in carers, support for carers, is important in that respect as well?
Absolutely. So in terms of the offer for carers in York, that's been really, really strong over a number of years. We work really closely with the Carers Centre and fund that as a major asset in York. And we're really lucky to have such a great centre for people and some really good people who we work with. And clearly investing in carers, helping them to have the best life possible so that they can go on to continue to care for the people they love is really, really important, both for them and for those individuals with care and support needs. And certainly we don't do that with the intention of creating savings for the council, but clearly that is one of the best ways in which we create community support. And certainly it does do much to keep demands from the council lower than they would otherwise be.
Thank you. And Pippa, we've worked much more closely with the health services, especially due to the pandemic, and that shows up in the Better Care Fund. Can you just tell us a little bit about that?
Yes, thank you, Chair. So for people that might not be familiar with it, the Better Care Fund is the name given to a range of funding streams which have existed over several years now. Its total value in York in the current financial year was around £19 million. And some of that is invested in services which you know, are really sort of linchpins of the local picture. So services provided by the Foundation Trust in the community, services in primary care, or some aspects of the ambulance service. But also, more importantly, I think for me and close to my heart are all the voluntary sector organisations and the work that we do preventatively. The goal of the Better Care Fund is around integration and seamless services and prevention and building resilience so that people can live their own lives without needing to be dependent on services. So sort of building on what Michael was saying, a lot of the work we do there is absolutely in partnership and building joint plans together so that we can wrap services around people where they need them and then get out of their lives so they're living more independently. Some of the services that people might be familiar with in communities are things like local area coordination, social prescribing, support for carers, support for reablement, those sorts of things. And we can only deliver that by working in partnership, both with the health service, primary care as part of that, as well as community health services, the voluntary sector, the council, and also, in fact, local communities, as well as the independent sector.
Thank you very much, Pippa. And I've just got about 3 questions for Amanda, please. Amanda, what did the consultation tell us? I know that Debbie said it was still open. What are we seeing from the consultation?
I think that's one for Debbie rather than for me, Councillor
Right,
Runciman.
okay. Debbie?
Yeah, so we've had 787 responses to the when we published the report, so that was until the 3rd of January. And the majority of people, so 44% of respondents agreed that to balance the budget and accelerate recovery, they would want us to increase council tax rather than provide fewer services. And 37% of people did support the highest level of increase. In particular, what was encouraging was that 55% of the respondents did support taking the full social care precept of 3%, which I think is encouraging given that that funding is ring-fenced to adult social care. And the in terms of the priorities, the largest priority for residents is to prioritise our public health response to the pandemic, including support for mental health. So again, that was encouraging responses really, and coincides, you know, corresponds with what is in the budget proposal.
Thank you, Debbie. If I go back to Amanda, it looks to me, Amanda, as if we're doing things differently rather than just making savings. Would you say that's right?
I think we're doing a range of different things. We are trying to make savings where, as I said before, where we can look to manage the market differently or procure differently over a bigger footprint or with our partners, so we get some economies of scale. But most of the proposals that are presented are about looking at how do we work differently. So Pippa talked a lot about how do we create services that build resilience in people, that mean we don't have to be part of their lives. I trained as a social worker, and kind of behind the philosophy of social workers of a profession is that you're almost trying to do yourself out of a job. What you're trying to do is intervene in people's lives for the shortest period possible so that they can live the best life possible. And that's what we're trying to do with a number of the projects that we've got outlined and the number of proposals we've got outlined around how can we have that conversation with people about what does your best life look like, and what can we do that means that you're integrated into your community and into those services that naturally wrap around you to help you live that best life. So one of the examples that some of you will have heard me talk about before are some of the great programs that are happening for young adults with learning disabilities that are around things like volunteer schemes. So one that I like a lot is a scheme called Gig Buddies, which is about supporting adults with learning disabilities to befriend people who've got similar taste in music to them so that they can go along to gigs together. Now, that's a great way to do something that you really want to do that isn't dependent on a service. It's about creating lifelong resilient relationships in communities rather than it being a formal carer that goes along with you. So it's different approaches to delivering better outcomes.
Thank you. So what we're trying to do is to enable people to live the best lives possible with the support that they need as independently as possible. Would you say that's right? Yeah, thank you. We haven't, I don't think, answered all the questions. We've covered quite a few of them. So I'd like to move to the recommendations. I'm happy to accept the revenue savings proposals in the Annex 1 and the growth proposals as in Annex 2, and the feedback from the consultation as in Annex 3, and the new schemes for the capital programme as in Annex 4. So I'm quite happy to accept all those, and I'd like to thank everybody for their so much hard work went into this. It's not been simple at all, as our speakers quite clearly identified. It'd be really good if the government would come up with their green paper, which they've been promising for years. But meanwhile, we do the very best we can with what we've got. So thank you, everybody, for listening and watching us today. And thank you all the members from the officer group who've come to support this particular decision session. Thank you and goodbye.
Can confirm the live stream.